Okay, let's get into it. We're doing a deep dive today into, a really complex area. Vascular surgery.
Hmm.
I mean, you think about it, you're dealing with the body's, entire plumbing system, right? Highways, pipes.
Absolutely.
Yep.
And it's incredibly high stakes.
Yeah, tiny issues can cause huge problems, so getting really, really good at it takes more than just memorizing facts, doesn't it?
It really does. It's a field that's, always changing, new techniques, new research all the time.
And you need to make quick calls based on, well, a lot of complex stuff.
Exactly. So you need resources that go beyond just the what. They need to explain the why. Why is this the best approach in this specific situation?
Right. And that brings us to our source material today. It points towards a particular book, 100 Questions and Answers in Vascular Surgery by Dr. Atef Ahmed.
Hmm.
So our mission really is to unpack why this specific guide is flagged as so essential, for anyone in this field, whether they're just starting or are seasoned pros.
Yeah.
What makes this book stand out? What's its approach to helping people achieve, well, the source calls it mastery?
Well, one of the first things the source highlights is the author, Dr. Atef Ahmed. He's specifically noted as a renowned medical educator.
Okay, so not just a surgeon, but someone who knows how to teach this stuff.
Precisely. That's key. This isn't just a list of facts. It's information curated and presented by someone who fundamentally understands how people learn complex medical topics. That educational perspective is apparently baked in from the start.
Got it. So expertise translated effectively. And the title, 100 Questions and Answers, that sounds pretty straightforward format-wise.
It does, but the source suggests it's more than just simple Q&A.
How so?
Well, it emphasizes that these aren't just random questions pulled out of thin air. They're carefully selected,
Okay.
designed to mirror the kind of challenging clinical scenarios you'd actually face. The whole thing is described as an interactive learning experience.
Interactive. In a book.
Yeah.
How does that work? Seems a bit tricky.
Yeah, it sounds a bit counterintuitive, doesn't it?
Yeah.
But the way it achieves this, according to the source, is by really digging into the rationale.
Oh, okay.
It stresses that the answers give full, detailed explanations, focusing on the why behind each treatment approach. So it's not just, okay, for condition Y, you do X.
Right, it's why X, why not Z,
Yeah.
why X for this patient with these specific factors.
Exactly. That's the core of it, understanding the reasoning.
That makes so much sense, especially in a field like this where, every patient presents a bit differently and complications are always a possibility. Knowing the why gives you a framework, right, to handle the unexpected.
That's precisely the idea. You're not just memorizing steps in a protocol, you're building the underlying mental model that lets you adapt when things don't go exactly by the book.
Mm-hmm.
And apparently it covers a really wide range. Everything from, basic principles, maybe the hemodynamics behind a certain condition, right up to the very latest treatment strategies and advancements.
So, understanding why a really calcified lesion might need a specific angioplasty technique compared to a softer one.
Yeah, exactly.
Or maybe why the latest guidelines for managing, say, deep vein thrombosis shifted. It connects the dots between the theory and the messy reality of practice.
That's what it aims for, that blend of solid academic knowledge, the latest evidence-based practices, current clinical guidelines, all presented through this very practical, scenario-based Q&A format.
That structure, focusing on scenarios and the why, sounds like it would be amazing for exam prep. Does the source mention that?
Oh, absolutely. It explicitly positions the book as a really valuable tool for anyone getting ready for board exams or certifications.
Because it tests application, not just recall.
Exactly. By making you wrestle with these challenging situations and explain the why, it forces a deeper level of understanding. It's a comprehensive review that hits clinical judgment hard.
Yeah, that makes perfect sense. Those exams aren't trivia contests. They're about showing you can think like a competent surgeon. And that comes from understanding principles, not just facts. So who exactly does the source say this is aimed at?
It seems pretty broad, actually. It mentions surgeons, residents, medical students, the expected groups.
Right.
But it also points to experienced doctors looking to refresh or update their knowledge.
Yeah.
And specifically, yes, people studying for exams. It seems designed to be useful at various stages of a career in vascular surgery.
So it provides a kind of consistent framework for thinking through tough decisions.
That seems to be the goal.
So say you're a resident, maybe facing your first difficult on-call case, or you're an experienced surgeon trying to quickly grasp a new guideline on, I don't know, carotid artery stenosis. This format lets you zero in on the critical thinking needed for that specific situation.
That's the idea presented. By structuring it around these focused questions and giving detailed rationale, it's meant to speed up the process of really internalizing complex decision-making.
Like targeted coaching.
Yeah, like getting coached on the hardest parts of the job. It's presented as being about building that framework for practical problem solving, especially when you're under pressure, not just collecting knowledge.
Okay, let's try and wrap this up a bit. We've done our deep dive into the source material on 100 questions and answers in vascular surgery.
Yep, by Dr. Atef Ahmed. We've seen how his background as a medical educator really shapes it.
Right, and how that Q&A format, those 100 scenarios, aim for an interactive feel.
And crucially, that intense focus on explaining the why behind the decisions, not just the what.
And we touched on its value for exam prep and just generally for keeping current. It seems to bridge that gap between textbook knowledge and real-world practice, reflecting current guidelines.
Ultimately, the source suggests the book's goal is to give readers that deeper insight, that critical thinking ability needed for making good calls in such a dynamic field.
It's about getting beyond just knowing the steps.
To really understanding the reasoning behind them, yes.
So, for you listening, whether you're involved in vascular surgery or any other complex field, really, looking at how a resource like this is put together is interesting. It shows that real mastery often isn't just about piling up facts. It's about engaging with the tough stuff, the challenging scenarios.
And digging deep into the why, understanding the fundamental reasons behind things.
Which brings us to a final thought, maybe something for you to chew on.
Okay.
If getting to mastery in a complex, changing field like vascular surgery really hinges on understanding the why through these tough scenarios,
Yeah.
what fundamental why question do you think is the most important one to ask right at the beginning when you're first trying to truly get your head around any complex subjects? Something to consider.